Assalamualaikum. I hope so you're doing fine. I'm Dr. Muhammad Ali Rabani and we'll start in the posterior compartment of leg. We'll start with the overview and the overview will discuss the surface landmarks, the subcutaneous tissue containing the veins, lymphatics and nerves, deep fascia, boundaries and contents. The surface landmarks are not very much, they're very simple. On the posterior aspect, you may be able to palpate the condyles of tibia on the back here. You will see the hamstrings on the lateral aspect, that is bicep. On the medial aspect there will be membranosus and tendinosus. Here you will be able to palpate the belly of the gastrocnemius and deep to its soleus, and as it goes down, that is the most important one, the calcaneal or Achilles tendon. So these are the major things. Superficial veins and especially the small saphenous vein may be prominent right here. As subcutaneous tissue is there, it's a superficial fascia, and it contains cutaneous nerves and vessels. Please ignore this line, let me remove it. Okay, it contains nerves and vessels, and it has on the topic of the superficial veins, it contains small saphenous vein starting from the lateral end of the dorsal venous arch, passing behind the lateral malleolus, receiving tributaries from the back of the leg, communicating with the great saphenous, and ultimately diving deep into the fascia lata from anywhere between the middle of the calf to the popliteal fossa and joining the popliteal vein. Lymphatics, they basically follow the small saphenous vein all the way till they reach the popliteal fossa and drain into the popliteal lymph nodes. Cutaneous nerves. If you have done the cutaneous innervation of the anterior aspect of the leg, this is very much similar to it, except for one difference highlighted here. On the medial aspect of the posterior surface, there will be saphenous. On the lateral aspect above, lateral cutaneous nerve of calf, below sural nerve, and that's a different one by the way. So there are, let me go through them again. On the medial aspect, there is saphenous nerve, that is the branch of femoral nerve, and running along with the saphenous, great saphenous vein. And then on the okay, okay, let us start again. On the medial aspect, there will be the saphenous nerve, that is a branch of femoral nerve. On the lateral aspect, there are two nerves. On the upper part, that is the lateral cutaneous nerve of calf, branch of common peroneal, the same one as we discussed in the anterior aspect. And the infralateral aspect, there will be sural nerve, that is different from the anterior aspect, that is made by roots from both common peroneal and tibial nerves, and the middle part in the upper half continuing from back of thigh, popliteal fossa roof and into the calf, that is the posterior cutaneous nerve of the calf. These are the posterior cutaneous nerve of the thigh basically. So these are the four nerves that are going to supply the back of leg. It will have superficial veins, similar perforators connecting to the deep veins and to the superficial great saphenous vein and so on. Deep fascia covered by fascia lata throughout, and the special modification here is this flexor retinaculum running between calcaneum and medial malleolus. We will go into the further detail in the separate lecture for the retinaculum. Boundaries. Discussing here, there is fibula, this is tibia, interosseous membrane between them, this fascia lata around, anterior intermuscular septum, posterior intermuscular septum. So this is, this is the posterior compartment basically, all the way from here. So this is the posterior compartment, whole of it, and it is bounded posteriorly by fascia lata, anteriorly by interosseous membrane, and here there is fibula and anterior intermuscular septum and their tibia. And to divide it into two parts, there is this one. This is the transverse intermuscular septum, and this is the one that divides into the superficial compartment and the deep compartment. The deep compartment can further be divided by tibialis posterior, but let us not go there. So these are the compartments, and from there, this picture you can devise the boundaries to contents. The superficial compartment contains three muscles, showing the gastrocnemius cut here, soleus and the plantaris muscle, a very small one, the tendon of the plantaris muscle basically. And that if we remove these muscles, we will see three muscles below, that is the tibialis posterior, extensor digitorum and extensor hallucis. And the arteries, there are two arteries basically, and the posterior tibial artery containing its continuation and the peroneal branch and the tibial nerve. So these are the structures that are making the contents of this posterior part of the calf. So that is about it. That's the general overview of the posterior compartment of leg. We'll go into the details of the muscles in the next lecture, and then we'll discuss the arteries and the nerves in the separate lectures. And keep following us. If you have any questions, suggestion and feedback, do let me know. Thank you. Till next time. Allah Hafiz.